Hello, my name is Melissa Wofford, and I am here to discuss the Crowded Clinic case study. This case study really represents some of the challenge that we're facing today in healthcare. An overview of this case study. Again, this case study truly highlights the issues of access to care for our vulnerable, diverse populations and how community health centers are challenged to find ways to improve access, not only to improve patient satisfaction, but most importantly, to improve the patient outcomes. Walt Disney said, "The way to get started is to quit talking and begin doing." And that really says it all. Our institutions around the country are really trying to find out how can we increase care? What do we need to do? Especially with COVID and the pandemic and, staffing shortages and rising costs. So it really is a challenge, and we've got to find ways to meet the needs of this population. What went wrong in the case? And I thought a lot about it. I read this case study a lot, and there were several things that I picked up on. Um, One was this clinic just didn't prepare for the diverse population that it serves. There was clearly a lack of organization, a lack of staff training to understand the special needs of this population, um, not enough staff or providers, an appointment system that was failing to meet the needs of the patients. They couldn't get appointments for care for months sometimes, no sick appointments available. There were walk-ins. And all of this led to a snowball effect. It did contribute to long wait times for patients, walk-ins, unhappy patients, and unhappy staff. How can these issues be resolved? Before you can resolve any issue, you first have to identify what those issues are. Some of the ways that I thought are important would be, again, you've got to bring these stakeholders together. Everyone involved needs to be together, and that includes the patients, office staff, clinical staff, providers, and administrators. You get everybody together, you brainstorm. What are the issues that you see, and how can we resolve these issues together? Who and what role do other disciplines have in resolving these issues? And I really truly believe that everyone plays a role in the success of this clinic, including the patients. Some of the providers that I've included, the disciplines where everything needs to start at the top. So your administrator, your medical director, they need to work together. They need to work together to find funding so that they can bring in more staff and providers. The medical director needs to work with the staff to come up with a patient contract that really outlines what the clinic's expectations are of the patients and what the patient's responsibilities are. Of course, your providers, your doctors, your nurses need to work together to try to improve these outcomes and the patient experiences. Your RN is an extremely important piece of this clinic. They have the background, the skills, the critical thinking ability, and they need to educate these patients on their disease processes and their medications. For example, your office manager, she needs to develop diversity training programs, customer service training programs. Your case manager needs to be involved. She has the knowledge to help these patients find the assistance and services that they need. Um, what is the proposed solution? Thought a lot about this. I read this case study, and I know I'm missing some things, but some of the solutions that I thought would be, again, that stakeholder meeting to identify the issues and how to resolve the issues. For a clinic that is multicultural, diverse, bilingual, you also need to hire staff that is multicultural and bilingual. You want to include the patients. Getting their feedback is important. You want to determine their social determinants of health. You want to assess their access to technology. Do they have a phone? Do they have internet? Do they have a computer? Do they know how to use it? Have the patient sign this contract. They need to see in writing what their responsibilities are, what our expectations are. A big one to me is flexible hours for our patients that have transportation issues, mobility issues, disabilities. They may not have an opportunity to get to the clinic. So, flexible hours are important, including early hours, Saturday hours, especially for those that are working and can't take off. I also feel it's important to build in sick appointments. This case study mentioned that acutely ill patients weren't able to get in for days. That can't happen. You've got to build in sick appointments to get these patients in, evaluated, and to start treatment. We need to look at updating the software to improve our scheduling system. Mobile phone support is a big one. A lot of these patients will have phones and nothing else. Do they have email? Do they know how to check their text messages? We can send important health alerts, text messages, appointment reminders to that cell phone. We need to establish a telehealth program for some of the reasons I mentioned just a second ago, and that is mobility issues, transportation issues. It is a way for these patients to get to have a face-to-face with their doctor. This doctor may not be able to lay hands on the patient, but he can certainly evaluate them and get a good history. Another important thing to consider is a telephone triage nurse. Have a direct line to that telephone triage nurse, not go through a call center, and have a strict policy with the staff. You've got to call these patients back as soon as possible. Some other things, assist patients to gain access to a patient portal. They need to be able to read their records, see their lab results. I also want to set up a patient computer station in this clinic. They may not have internet or a computer, but while they're there, they can get on this computer. They can see their records, and I think that's really important. I want to have an insurance specialist or that case manager there that can help these patients find affordable insurance plans or assist with signing them up for Medicare or Medicaid. I also think it's vitally important to secure funding. Seek out corporate partners for grants or monetary donations so that we can get in equipment and supplies. In a clinic like this, there are barriers, patient barriers, as well as organizational barriers. Some of the patient barriers we've sort of touched on, but lack of insurance, cultural, language barriers, disabilities, inability to take off from work, and geographic and transportation barriers is a big one. We have organizational barriers, funding uncertainties, declining reimbursements, our workforce shortages, rising cost, and our patients are sicker with chronic long-term diseases. In summary, our community health centers deliver affordable care to our vulnerable populations, and they are vital to increasing equitable access to care to all patients. To meet the needs of these patients that they serve, there must be that multidisciplinary team that understands the specific needs of their patients, has a shared goal of providing high quality care to all, and has an office infrastructure in place to assist them in meeting this goal. The last slide is a quote that we've probably all heard, but I wanted to include it because I think it's so important. Helen Berry said, "Helping one person might not change the whole world, but it could change the world for one person." Thank you.